Hi, everyone, and welcome to a special edition of Q&A with Dr. K. Normally, my friend Annie Hagen asks me the questions, and I try and give as many A's as I can in the way of answers. This time, I'm going to be asking the questions because I have a special guest with me today. As many of you are aware, I work for a wonderful organization called Plant-Based TeleHealth, and we do telemedicine consultations and for lifestyle medicine, get people healthier through what they eat and how they live their lives. And it brings us all great joy to have our patients get healthier and happier. And our practice has been growing. And we've been fortunate enough to have some really first-line physicians join our plant-based telehealth team. And I'm here today to introduce one of those new additions to our team to you. And he's Dr. Jeff Pierce. I really like Jeff. He's a man after my own heart in many ways, a family physician with an interest in women's health, and just an all-around good guy. And we're very lucky to have him on the team. So with that, I'd like to introduce you to our new colleague at Plant-Based TeleHealth, and that's Dr. Jeffrey Pierce. Hey, Jeff. Welcome.
Hello. Thank you so much for having me. I'm honored to be here.
Oh, lovely. Jeff, tell me where'd you go to med school, and where did you do your residency training?
Sure. I did all my training up until residency in Texas, where I was born and raised. And my medical school was in Houston at Baylor College of Medicine.
Oh.
And when I finished medical school, I came out into California to do family medicine residency in Santa Rosa, California, just about an hour north of San Francisco.
I know Santa Rosa well. I lived there for 7 years. That's where Dr. Goldhammer has his True North Health Center. So we both know that small city very well. Now you have finished a complete residency in family medicine. And,
that's right, I did. Mm-hmm.
And yet you are heavily involved in obstetrics and babies and women's health. How did that happen? What kept you? Why did you go into obstetrics? You're a great family doc. I'm curious how the intermixing happened there.
Sure. Well, let's see. In medical school, you have to decide which field you're going to apply to so that you can become that sort of a doc. And I really liked OB, but then the next month I really liked medicine, and then the next month I really liked pediatrics. And, so on and so forth. There were not a whole lot of the rotations that I couldn't see myself doing any more of, but there wasn't really one rotation where I thought I can only do this. And so family medicine felt like a great fit for that reason. And also the people that were there that were our mentors at Baylor were just great, good people, very smart. I feel like someone could come and have a question about, their patient who was pregnant, and also about their recently born child, and about the grandmother that was on hospice. And these docs could answer all those questions. And so I wanted to be like that.
Spoken like a true family physician in his heart. That's really wonderful. I originally had long ago signed up to become an otolaryngologist. I got into an ENT residency, and I couldn't bear as we went on to give up everything from the collarbones down. So I left that and went back to general practice. And I know the feeling that you have. The field of family medicine is so broad and fulfilling. You just want to have the entire experience and give to the entire family. That's really, really beautiful. Your family, you have a child, I understand?
That's right. One daughter, her name is Camille. She is 7 years old, and she was born at my old training hospital in Santa Rosa, and we are just pleased to have such a brilliant and feisty little girl.
I've heard wonderful reports about her, and it's something. Any man who has a young daughter, my heart goes out to him and rooting him on. They're the unsung heroes of our society. To raise a young daughter and give her a good role model is a beautiful thing, and just doing a wonderful job on that. So we're practicing telemedicine these days. When you sign on in the morning, who are patients that you especially feel enthusiastic about treating? You're women with various gynecologic problems, or again, the whole panoply of family medicine.
For sure. So, I am very happy and pleasantly challenged by seeing people who are bringing concerns and issues from all walks of life. So, I might have a patient who is, she's just found out she's pregnant and she's 150 pounds overweight and has underlying diabetes and chronic hypertension. And, she'll do a double take when I tell her, you know what, a lot of these things can be halted and even reversed with some not too difficult changes in your lifestyle. And so that is a lot of fun, meeting somebody at the sort of beginning of their plant-based journey. And then, on the other end of the spectrum, there might be somebody who is been living with a chronic condition, a chronic autoimmune condition, who, he or she has been trying all sorts of medications and not maybe even procedures and not seeing things get better. And to get to walk along with them, trying little changes that might help their condition that they were told they were going to have for the rest of their life, that it was only going to get worse unless they took this $500 a month drug. That also blows me away. So, the whole spectrum is something I enjoy getting a chance to help out a little with.
Well, in that answer, you heard an experienced physician. Clearly, he's got that ring of that fellow who's carried the beeper in the middle of the night and dealt with all sorts of situations. But very compassionate man, and one who feels for the human condition. We are really lucky to have Dr. Jeffrey Pierce with us as part of the plant-based telehealth team. Dr. Pierce, so in what states do you have active medical licenses at this time, and any plans on getting any more of them?
Sure. So I'm currently licensed in California and in Texas, and then hopefully Florida will be coming soon.
Excellent, great. So if you would like to speak to this wonderful physician, this very talented MD, and especially if you're someone of the female persuasion and you grew up living in California or Texas, this is a doctor you want in your corner. So this is Dr. Jeffrey Pierce. I hope people will take advantage of the wonderful services that he offers, and take advantage of all the wonderful physicians that now have a rightful place on the team at Plant-Based TeleHealth. That's plantbasedtelehealth.com if you're looking to make an appointment. Dr. Jeffrey Pierce, thank you, Jeff. It's really always good to see you in any capacity. And I really enjoyed our few minutes here together to meet the folks who follow me along on my YouTube channel. So thank you very much, and look forward to seeing you at the next Plant-Based TeleHealth meeting. And we'll be meeting along the way, I'm sure. Take care, Jeff. Thanks again.
Thank you so much, Dr. K. Appreciate it.
Hi, everyone. Dr. Michael Klaper here, announcing our new format for our Q&A with Dr. K. Annie Hagen will be asking me one question that's been sent in by our viewers. So if you want to see if your question is getting answered, do join us for our Q&A with Dr. K right here. Hope to see you then.